Hello and welcome to the Supportive Care Services Virtual Lunch and Learn series. My name is Voncel Hunter, Marketing Specialist with Ironwood Cancer and Research Centers. We've created a series of Lunch and Learn videos to help you be successful when navigating your cancer journey. Our Supportive Care Services Department is here to help you get actively involved in your healing process. For more information about the Supportive Care Services Department, please email socialwork@ironwoodcrc.com.
Good morning, everybody, and thank you for joining us for today's Supportive Care Service Lunch and Learn. Today we have Emily Wolfe, Certified Medical Assistant for Dr. Heidi Rula, our Integrative Oncologist, here to talk about an oncology medical assistant's role in your patient care. Please help me in welcoming Emily Wolfe. Hi, Emily.
Hi, good morning, everybody. My name is Emily, and I am going to explain some things and what we do on medical. Okay, let's scratch that. Oh my good Lord. I literally have PowerPoints on my hand right here. Ugh.
It's okay. It's okay. All right. So 1, 2, 3. Good morning, everybody, and thank you so much for joining our Supportive Care Service Lunch and Learn. Today, we are here with Emily Wolfe, Certified Medical Assistant for Dr. Heidi Rula, and she's going to be presenting on an oncology medical assistant's role in patient care. Please help me in welcoming Emily Wolfe. Hi, Emily.
Hi, good morning, everybody. My name is Emily, and here today I'm going to be explaining an oncology medical assistant's role in your care. In supportive care, we're here to optimize your health during your treatment. So we're going to get into the lunch and learn today, and we're going to talk about a couple things. We're going to review the role your medical assistant plays in your care.
I'm sorry, you forgot to introduce who you are, what you do here.
Are you kidding me?
Look at your notes. Look at your notes.
I did.
That was really good, though. Do it exactly the same.
Farts.
You were very relaxed. So
Yeah, that was really good. That was your best one. So do it exactly like that.
She is
no pressure.
listening. You told me she wasn't listening. She listening?
I'm listening. I'm just not watching.
Okay, ready?
Ready.
1, 2, 3. Good morning, everybody, and thank you so much for joining us for today's Supportive Care Service Lunch and Learn. Today, we have Emily Wolfe, Certified Medical Assistant for Dr. Heidi Rula, our Ironwood Integrative Oncologist. Today, she's going to be presenting on an oncology medical assistant's role in your patient care. Please help me in welcoming Emily. Hi, Emily.
Hi, good morning, everybody, and welcome to the Lunch and Learn today. My name is Emily Wolfe, and I work for Dr. Heidi Rula over at Integrative Services at Ironwood Cancer Center. I'm here to explain a couple things and just keep you kind of updated. Here in supportive care, we are here to help and optimize your health during your treatment. So we're going to get into the Lunch and Learn today and talk about a couple things. Today, we're going to review the role your medical assistant plays in your care. And we're also going to learn the importance of the visit procedures, review which clinical staff you should speak to when you need some assistance, learn who completes your FMLA and disability paperwork, also review why you should bring an updated medication list to your appointment, and how to add or remove people from your HIPAA. Med-onc medical assistants and radiology medical assistants do the same things when they bring you back to a room. So we're going to go over that. When you arrive, we take your vitals when you get into the room, which consists of your blood pressure, your oxygen, your heart rate, and we make sure that those are all okay and stable. After that, we'll go and review your medications, your allergies, and your smoking status. We go over that just to make sure that everything in your chart is up to date and that we have everything straight and nothing looks weird. Us as RadOnc and MedOnc, we also send referrals to different areas to support your care, whether they be in Ironwood or outside. We send labs to the appropriate testing facilities that you need. We also check your labs and make sure that they're complete before you come to your appointment. Med-Onc and Rad-Onc also complete your FMLA paperwork and your long-term disability paperwork. So each time you come into the facilities, your vitals will be the same. We will make sure that you are maintaining a healthy body weight during treatment. We will also make sure that your blood pressure and your oxygen saturations are good, just so that we know that your body is not fighting another infection or that other things are not going on. We let the doctors know and they go from there. We also do your mental health. Our questionnaire is for you. Is it very important to you to make sure we are providing your mental support and that you are safe. We also go over your medications just to make sure that all your medications are up to date and that they are good with where you're taking them and how you're taking them, just so that during treatment and post-treatment and before, everything is kind of mapped out and laid out and it's okay. Questions for your physician. If you ever have any questions, the best way to go is to follow up by phone. Call the office where your oncologist is based out of. There should be a business card at the checkout desk or the check-in desk. You can submit questions through Care Portal as well. You have to set up an account first, and if you have any questions with that, ask the checkout ladies. The difference between calling a triage nurse and the medical assistant. We want to make sure that we get you the help that you need as quick as you need. So when you need if you were to call a triage nurse, it's going to be for treatment related, or if you're feeling sick and need medical advice. If you're calling and you need follow-up questions for your oncologist, or questions on your prescriptions, a referral that was sent, FMLA paperwork, anything like that, that's going to go to the medical assistant. So who completes my FMLA and disability paperwork? We get that question quite often. So your MA does your FMLA paperwork and your disability paperwork. Again, we see a lot of patients and we just want to make sure that you allow us enough time before calling so that we can get it to the physician. The physician can review it and change what they need to or not change what they need to. And then we can complete it for you, give you a call, you can pick up a copy, and then we can send it where it needs to go. The turnaround time for a call is about 24 hours for routine calls. Treatment related concerns, call the triage nurse and they are pretty quick to get back to you. If you have any emergencies, call 911 or call your nearest emergency room. Don't wait for one of us to call you back because you need to get help as soon as you can. So we get a lot of questions too. Do you need to bring an updated medication list each time you come? Medical assistants, we will call you the day prior to your telemed appointment to review medications with you. Again, it's just to ensure that everything is the same in our system as you have either on a piece of paper or on a card. If you're coming into the office, we go over them while we're sitting in the room and waiting for the physician. It's always good to have an updated card you carry with you. I think that it always is a good idea to have it updated, maybe in your wallet or in your purse or in a book that you have with all your stuff, just so that if the dosages change, we can change it in the system, just so that we're not interacting with anything like that. So we're going to go over HIPAA. Family members can call in regarding your medical concerns. However, HIPAA forms are needed for any family member or caregiver, friend, whatever they are, just so that we know that it's okay to release your information. HIPAA forms can be obtained at the front desk, and at checkout desks. It's for your safety, for your medical safety, just so that we know who we can talk to and who we should not be talking to. And you can add as many people on there as you want, and you can take them off at any time. So we send out referrals too as medical assistants. We send them both to internal and external referrals to other providers that are going to be assisting with your care. You can go through other providers too. You can go through us as MAs to make sure that they've been sent. You can also call the other provider that we've sent the referral to make sure that it's been sent. If they've gotten it, you should be able to schedule. If you have any issues or any concerns, your medical assistant is who you would like to reach out to. So reminder calls. Our system will send out a text the day before your appointment, reminding you of the appointment, the date, the time. If you're doing a telemed appointment, the medical assistant of your doctor that you are seeing that day will call you the day before, go over all your medications, your smoking, and everything like that, and remind you of the time, and send you a doxy link. Any questions?
All right, thank you so much, Emily. What helpful information that is. So we do have a few questions here. Let's get started with our first one. Our first one is, what are the different types of medical assistants that are at Ironwood?
We have an injection medical assistant at all of our locations, and we have a radiation medical assistant and a medical oncologist assistant. The medical oncologist helps with your oncology physician. Your radiation medical assistant helps with your radiation and your treatment. And then your injection MA is for all of your injections that you're getting, and they work close or in the area of where the nurses are.
Great, thank you. Next, do I call you as a medical assistant if I need to cancel or reschedule my treatment or office visit?
For Dr. Rula, I will cancel your appointment and I will reschedule you as well. However, for the rest of the clinics, it's a little bit different. The best way to do is to call, and I believe that you'll get an operator, tell them why you're canceling and that you need to reschedule. And from there, it'll go in the system and somebody will give you a call to reschedule unless they schedule you then.
Perfect. Now, can you draw my labs at the clinic, the ones that my physician is requesting, or do I need to go to an outside lab?
So we do not draw labs here. I know that there are specific labs that sometimes radiology or medical oncology will pull, but not a full panel like your doctor wants. You would have to go to LabCorp or SonoraQuest or whatever lab you choose to go to. And when you check out, they'll give you a printout of everything.
Great, thank you. Now, do they need to have that lab order with them, or will the physician send it over to the lab for it to be drawn?
You need to have that lab order with you. Sometimes it'll go through the system. However, a lot of the times it doesn't. So the best thing to do is have that order with you in hand so that when you get your labs drawn, it's already in your hand and there are no miscommunications, no labs that have been dropped or anything like that, and it's all taken care of.
Great, good information. Now, do you guys know how much my chemotherapy or radiation treatment is going to cost me?
The medical assistants do not handle any of that. You'll see a benefit coordinator and they will go all through that and pricing, and you will meet with them. But on the medical oncology, like medical assistant side, we don't go through any of that, and we don't know how much it costs because each person and each insurance is different.
Great. And do I need to bring my CD from my imaging in when I see my doctor for a follow-up?
So at Ironwood, we have many places that we can get your CD from. So if you go to Simon Med or anywhere like that, we can get those. If you want to bring it in, that is completely fine. But 9 times out of 10, your doctor has already seen those because they've already been sent to us. If you want to make sure that they have been sent to us before your appointment, the best bet to do is go ahead and call the office to make sure that that disc or those images are in the system and your doctor can see it.
Great, thank you. And then our last question here is, how do I request my medical records from any visits that I've had with my physicians?
That will go through medical records. It's easier for them to get everything that you need sent over to you, either in a disc or in the mail or email or what may have you, instead of the medical assistant. Not because we don't want to help, but just because for them it's easier for them, and we have a whole department and they would be glad to help you.
Great, thank you. And thank you so much today for your presentation, Emily. We appreciate you being here and giving us all this information, and we hope that you will join us again in the future.
Thank you.
Thank you for joining us for our virtual Lunch and Learn series. We hope you enjoyed this session. There will be a replay of this Lunch and Learn on the Ironwood YouTube and social media channels. For more information regarding our supportive care services classes and events, email us at wellness@ironwoodcrc.com. Thank you for spending time with us today.